Yeah, to answer this, we're joined by Jamie Jenkins, former head of health analysis and labour market analysis at the Office for National Statistics. Jamie, good to have you with us again on the programme. Do the stats back this policy decision up?
Well, one of the stats that you just quoted is correct. We've seen a huge number of cases among younger people, but I think the announcement on vaccinations in the past, obviously, was firstly about getting all the vulnerable people vaccinated. That was all about kind of saving lives. Now, if we actually look at the younger age group in children, and I've been looking at the latest numbers that have been published by the ONS, and since the start of the pandemic, we've seen 44 deaths across the country, in England and Wales, that is, where COVID has been mentioned on the death certificate and the person was aged 0 to 19. Now, other information from NHS England allows us to kind of work out then, of those 44 deaths, how many people have got underlying medical conditions, and we know about 80% of them would be. So we're talking probably around 9 deaths across the country since the start of the pandemic for people who are 0 to 19 who would have tested positive for COVID-19. And that's out of a total of 141,000 deaths. So the risk of death from COVID-19 is relatively low with regards to all this. But we do know that the vaccine, as you talked about there, does reduce the likelihood of you catching it. And we do know that the likelihood of passing it on as well. So I think that's part of the reason I think they're going for the decision today. But there's been a study out today which has been looking at children and looking at people about kind of long COVID and looking at the impact of people who catch COVID. We know the risk of dying is relatively low, if not non-existent practically, and looking at long COVID. So what the data they're showing today is that people who generally catch it with children, they don't show any symptoms. And of those that do, just 1 in 20 of them showed COVID symptoms about 4 weeks later, and less than 1 in 50 showed COVID symptoms 8 weeks later. So the relative risk of illness is pretty low, as well as death. I think one of the things from the press conference today, though, is that some of the kind of clinicians are saying that some children are going in and coming seriously ill. That's the information. I think we just need a bit more transparency on how big a risk is that.
Yeah, it's interesting because one thing they did bring up in that press conference was the risk of adverse side effects from the vaccine. This is the Pfizer vaccine. They were talking specifically about things like heart inflammation and were saying that it's around 1 in 100,000. And they say that that is, you know, a very small risk element. But looking at those statistics for the risk element of those who have caught COVID in that age group and ended up dying or indeed being hospitalized with severe infection, it's hard to see how the risk balance actually works out.
No, that's true, Alex. I think one of the things they will be trying to balance here is we know there's going to be very few deaths, and we've had very few deaths, if like I say, hardly any deaths at all in this age group. And remember, the deaths that are happening amongst people who are 0 to 19 as well, people who are vulnerable in those age groups from the age of 12 are already offered the vaccine, and that was the announcement taken a few weeks ago. And people who are also age 16 and 17 who are vulnerable, the first rollout of the vaccine, they were able to get that as well. So they're going to be, I think, they've got a bit of an issue in terms of why they're trying to make this decision now. Is we know that the schools have closed in Scotland in August. So they're going back in August now this month, and they closed in June, and the schools closed in July in England and Wales, and we saw cases come down. So we do know that this age group, say 16, 17-year-olds, and kind of very sociable, they're going to be mixing around. And it's probably what they're trying to do is if they can get this age group vaccinated, it may stop the spread of the virus amongst other parts of the population. But we've also had the adults vaccinated for a while now, and people have had opportunity to get 2 doses of the vaccine. So any spread from, say, younger people to older people, well, we've got the vaccine protection there. I think that's what they're looking at, is we do get a lot of cases in younger people, but the data relatively shows low risk. I think what's missing for me when I'm looking at the data really is people are saying that some people are going into hospital and getting seriously ill. We need to see that information. And it was quite disappointing from the press conference just now when I think one of the journalists challenged on what's the evidence and when are they going to publish the evidence. And I think they said, well, we don't have control of the evidence. Well, I think it's important if you're making these big decisions that the evidence is made available for all.
Yeah, it's difficult, isn't it? Because, I mean, we've always been presented with this vaccination, and then especially looking at potential adverse side effects, is actually you're more likely to get very poorly or develop long COVID or so on and so forth from actually catching COVID compared to having adverse reactions to the vaccine. But it seems to me that they stressed in this press conference that he actually said, this is Professor Wei Shen Lim, that there is a benefit to other people, but the main benefit is to children themselves. Are you suggesting that actually it's the reverse of that potentially this vaccination drive is more with the objective of trying to protect society and further mutations and so on and so forth?
I think there's going to be an element of that, Alex, because one of the things, if everybody, for example, the more people who have the vaccine in the population, the less likely the virus can kind of spread itself and kind of then dominate like we've seen in recent months, because we've seen a huge reduction in cases over the last few weeks, and in part that'll be down to some of the vaccine effect, and because we didn't see amongst previous waves, Alex, what we had is that we had rises in younger people, and we used to get big rises in older people. But remember, older people had the vaccine several months ago. They've had 2 doses for a while now, and what's been interesting in this kind of recent wave that we saw, that where we saw this big rise in younger people, we didn't see the equivalent rise in older people who had been kind of vaccinated much earlier. So I think it's probably trying to protect, and that's in part why they sometimes roll out the flu vaccine to younger age groups as well, is because it offers protection to some the kind of wider society in terms of doing it. I think just to be a bit more transparent would be useful in terms of these adverse side effects that are going on and reactions to the vaccines, because we know that no vaccine comes without risk. The older you are, the more benefit you're going to get from it, because if you do catch COVID, and we know that 83% of all the deaths have been over the age of 70, so if you're in that age group, it's a no-brainer. You definitely want to be taking the vaccine if you know you're at severe risk. But then the younger you get, kind of the benefit of the vaccine isn't as high. So I think the government just needs be a bit more transparent in terms of what's kind of the risk of the vaccine versus the benefit, because we know that as they get towards these younger age groups, it's not going to be as big as the older ones.
Yeah. Jamie, do you have any idea why the government wouldn't be so transparent? Why? Because all it does is it seems to fuel conspiracy theories.
Well, I think part of it is they're moving quite fast on some of this. And I would imagine as well that some of the evidence that we're talking about in terms of the reactions on children will be coming from other countries as well. And maybe that's the stuff that will be forthcoming, because I suppose one of the benefits the UK does have in this is it's not going to be the first to go with vaccinating some children. They've been vaccinating children in some other parts of the world at the moment. So they'll be able to look at that data. So I don't see any reason, though, if they've taken the decision today, why that information isn't available direct for any journalist or any parent or any child who's 16 and 17 can go and look at all of the information now. I think if that's forthcoming and available, it just, it should be out there immediately.
I mean, what's interesting here as well is the speed at which they're planning to roll this out, saying that actually this could be facilitated in essentially in a school term. But this is 1.4 million children. Do you think they're biting off more than they can chew? Are they still having to potentially try and get adults to get their second jabs, especially those in the sort of 25 to 35-year-old cohort? And there's also a big argument, of course, about the necessity to make sure vaccines are available in other countries to stop the circulation of COVID there being re-imported back into the UK.
Well, there's obviously a few different factors probably at play here, Alex. I think one of the things that we can criticise the government for the kind of a lot of things in COVID, not just the UK one, but the Scottish, the Northern Ireland and the Welsh governments. But one of the things that I think we could applaud is the vaccine rollout itself. It's been one of the fastest rollout in the world. So if they say they've got the vaccines ready and they can do it, I would probably say they will achieve that. But I think you've hit on an important point there, is that it's vaccinating, say, people who are at relatively low risk in our country versus other nations. Because if you think about variants, the latest variant, the Delta variant, which was known as the Indian variant, came from India. So the risk of new variants that kind of outbreak vaccines are always going to be there when you've got a worldwide pandemic, and other countries, for example, might not have the vaccination rates that they've got. They're probably looking to move fast as well, I would imagine, on this, is because, say, term times are going to be starting soon with the kind of the colleges and the sixth form students going back. And then there's also talk of the booster jabs. So are they going to then want to give booster jabs to some of the older population, which will put pressure on the vaccine rollout as well? So I think that's probably why they're moving quite quick. I suppose for the public at the moment, what's probably starts fueling some of these conspiracy theories as well is that, well, what's changed so quickly? It was only a few weeks ago they took the decision not to do this, but now they're taking the decision to do it. And I think it's sometimes when you get those quick U-turns, that's what causes some of the problems in some of the communication and the messaging around all these things.
Jamie, thank you ever so much for joining us once again. That's Jamie Jenkins, who is the former health statistician for the ONS, giving us his insight into the statistics behind that new announcement that 16 to 17-year-olds are about to get the jab.
Yeah.